Here are 5 things I would never ignore because I'm a hospice nurse. So to be clear, these things are outside of hospice. These are 5 things that you might see early on as symptoms that could really be something bigger. And I've just seen this in my work as a nurse and as a hospice nurse. So here are 5 things I would never ignore if I started seeing them in my life. So these are in a particular order. I'm listing them 5 to 1, 5 being the least alarming, I guess, out of all of them, and 1 being the most alarming. So stick around for all of them. Number 5, a persistent cough. Again, I'm not trying to be an alarmist here and make everyone worried if they have a persistent cough. There's a lot of reasons why you may be coughing. Allergies, maybe you have a cold, but something like a persistent cough that doesn't go away, I would definitely go see a doctor just to make sure there's not a bigger reason for this persistent cough. In general, this could mean a number of things. It could mean some kind of pulmonary disease, some kind of pulmonary cancer, lung cancer. You just never know. To me, it's always better to be safe than sorry. Number 4 is jaundice. So jaundice is a yellow tinting of your skin. The first place you usually start seeing it is the sclera of your eye, which is the white part of your eye. If the sclera of your eye ever starts turning yellow, or your skin ever starts turning a yellowish tint, go to the doctor. Again, this doesn't always mean there's something serious going on, but it can indicate something is going on with your liver and something is going on in your body. So if you ever start noticing this, please go talk to a medical professional. Number 3 is changes in your stool. So changes in your stool can definitely mean a number of things. On the serious end of things, it could mean or indicate that you may have colon cancer. So you want to just know what your normal stool is, what your normal routine is. You should be having bowel movements at least daily, every other day. So you want to notice, are you more constipated? Are you going to the bathroom too much? Does your stool look like a different consistency, a different color? Notice these things. I know that sounds crazy, but you should be checking out your poop. Also, it could mean something as simple, especially if you have blood in your stool, it could be something as simple as hemorrhoids. Hemorrhoids can cause blood in your stool, but it could be a bigger issue. It's always important to go to your healthcare provider just to be safe. Number 2, preventative health measures. What do I mean by that? I mean pap smears, mammograms, colonoscopies. These things you'll have to work with your doctor to figure out how often you should get them. I personally think every year you should be getting a mammogram pap smear. Colonoscopy is a little different depending on how old you are and genetics and things like that. You want to work with your own doctor for that, but those are really important too. So why are mammograms and pap smears so important? Mammograms, I think most of us know, can see if you have breast cancer, or at least detect something in your breast that could be possibly breast cancer. I have to go every year because breast cancer runs in my family. Pap smears can check for abnormal pap screening, right? So you might catch cervical cancer earlier, ovarian cancer earlier. It's important to have those screenings done. Colonoscopies are important because they can catch early signs of colon cancer, which is a very prevalent cancer in both men and women. 1 in 23 men and 1 in 26 women have a risk of developing colon cancer. So getting colonoscopies is a great way to screen for that. Lastly, with the preventative measures, I think it's important to see a dermatologist and also just to see your primary care physician yearly for blood work. Those checkups can be really, really helpful, and doing it at least once a year will be beneficial for you, in my opinion. And number 1, and the most important thing I would not ignore, is unexplained weight loss. Unexplained weight loss is the number 1 thing that I see and hear from my hospice patients who are now on hospice. They say it first started, a year ago when I lost 20 pounds randomly. They lose 20 pounds, maybe they needed to, maybe they didn't. They couldn't explain why they lost 20 pounds, but they had. This is the first sign of them knowing something was wrong with their body. Whether you're happy about the weight loss or you're not, please go talk to your primary care physician just to let them know what's going on and make sure everything's okay. So some cancers that are harder to detect, like pancreatic cancer, ovarian cancer, bile duct cancer, the first sign people see is unexplained weight loss. Not everybody, but a lot of people, unexplained weight loss. So if you do start seeing those things, again, could be nothing, but why not be safe than sorry? It's important to be an advocate for yourself because we all know that sometimes we can be dismissed by the way our medical system is set up. So knowing what to look for, knowing some signs and things you shouldn't ignore can be helpful for you. Be your own advocate and don't be afraid to get a second opinion if you need to. And remember, these things don't always mean there is something wrong or you do have a serious disease. It's just stuff that I wouldn't personally ignore if it was me or my family member, and I wanted to let you guys know about it.